The Union Health Ministry has clarified that there is no link between COVID-19 vaccines and heart attacks in young adults. Studies conducted by the Indian Council of Medical Research and AIIMS have identified lifestyle and pre-existing conditions as key factors behind the deaths. Now, it came a day after Karnataka Chief Minister Siddaramaiah suggested that COVID vaccines might be linked to a string of cardiac-related fatalities in the state. The ICMR and the National Centre for Disease Control have been working together to understand the causes behind sudden unexplained deaths, especially in young adults between the ages of 18 and 45 years. The study, in fact, was carried out from May to August 2023 across 47 care hospitals in 19 states and union territories. The study focused on individuals who appeared to be healthy but died suddenly between October 2021 and March 2023. There was a second study as well conducted by the All India Institute of Medical Sciences, New Delhi, with funding and in collaboration with ICMR. The findings have conclusively shown that COVID-19 vaccines do not increase the risk of unexplained sudden deaths in young adults. Statement issued, it was clearly said, and I quote, sudden cardiac deaths can result from a wide range of factors including genetics, lifestyle, pre-existing conditions and post-COVID complications. These findings, in fact, were made public a day after Karnataka Chief Minister Siddaramaiah suggested that hasty approval and distribution of the COVID-19 vaccine could be behind the rising number of sudden deaths among young people in the state. Siddaramaiah's post came amid reports that at least 20 people have died due to cardiac arrest in the state's Hassan district alone over the last month. He also announced the formation of a panel to study potential side effects of COVID-19 vaccines. Health Ministry now issuing a clarification saying that there is no link between COVID-19 vaccines and heart attacks in young adults. Do remember that this triggered a sharp debate, especially after Karnataka Chief Minister Siddaramaiah hinted that COVID vaccines could be linked to sudden cardiac deaths in young people. But now the Union Health Ministry has stepped in to clarify, saying that there is no link, backed by detailed studies from AIIMS and ICMR. The government says lifestyle issues, genetics and even post-COVID complications, not the vaccines, are driving these sudden deaths. Let me quickly go across to my colleague Goautam Shankar, who joins me over the phone line with more details on the same. Goautam, this entire issue created quite a sharp debate here, especially, as I was saying, after Karnataka Chief Minister Siddaramaiah said that COVID vaccines could be linked to sudden cardiac deaths in young adults. But now, Union Health Ministry stepping in, clarifying that there is no link.
Absolutely, because in Karnataka, there was a massive row because in Hassan district of the state, we were witnessing multiple deaths of from various ranges of age, from teenagers to even people as old as 60 to 70 were suffering heart attacks. And we had seen as many as 26 deaths in the last 40 days itself. But now we have a case where ICMR has ruled out any sort of COVID link in young heart attack deaths, and also an internal report that has been prepared by the Karnataka government, an expert committee that was formed there, and they have also come to a similar conclusion that there can't be any possible link that suggests heart attacks are connected with the COVID vaccinations as well. And Chief Minister Siddaramaiah was the one who had constituted a five-member panel to probe this sort of alleged spike in heart attack case in Karnataka Hassan district. And this clearly mentions now that there is no possible link, and whatever the cases that we have seen where people had taken the COVID vaccinations and suffered heart attacks, they had the comorbidities in the first case, and because of that, the heart condition was exacerbated, and that was possibly causing this heart attacks, fatal heart attacks in Hassan as well. So a detailed report is also still expected from Karnataka to be released tomorrow, and then we'll know what the Karnataka government actually plans to do as well, because they intend to release a set of guidelines regarding this as well, which also includes having a lot of children from schools as well who will be tested for this. And also there will be a number of guidelines for the general public as well, which also includes putting a ban on smoking in the state as well. So still, even though it has been ruled out that there is no possible link between COVID-19 vaccination and heart attacks, there will be a few guidelines that will be introduced in the state, Neha.